Okay, let's go to the prostate cancer. Mhm. In prostate cancer, what we should know, the same patient is asymptomatic, right? So anyway, we are doing screening for asymptomatic. Always keep this in mind because I know so much doctors have confused this screening with treatment. Okay, so don't do that. Okay, this is not hard. It's very easy. The this one. And okay, here we have to again categorize into three categories: average, moderate, or high. If you want, you can use my chart, this one, okay? Because I have simply write it down here. I have write it everything. This is the everything you should know, okay? For prostate cancer screening, but I'm teaching from this. Due for due for 2 years mean as example, doctor, you can think like this: patient is having five yearly cervical screening program. Okay, and okay, she's having a 5 year screening program at 30, and she was supposed to do the screening at 35. Okay, the next one, routine screening, but he not he sorry, she come to you after uh, after like he this she comes to you at 37 year of age. So that mean how long this patient is delay for the treatment, delay for the screening. That means 7 years, right? Or she was supposed to do the screening at 35, but she came for the screening at 37. So she's due for 2 years, right? So that is due for 2 years. That means the usual five screening program plus another 2 years. That's they are calling due for 2 years, right? Hope you understand or not. Do you understand? Yeah. Understand, right? Understood everything. Okay. Yeah. So prostate cancer. Here, yeah, okay. So prostate cancer, we have average, moderate, and high risk. So who are the average risk people? So average risk people are men without family history. So those are average risk people. So who are moderate risk? Men with a brother or father if diagnosed before 60 years, or multiple first degree relatives. Multiple first degree relatives. Okay? Multiple first degree relatives diagnosed with prostate cancer. So please remember this: brother or father if diagnosed before 60, or the multiple first degree relatives diagnosed with prostate cancer. Then the high risk patients are here men with three affected first degree relatives diagnosed with prostate cancer. So here, please follow this one. Okay, this also have changed. Again, I'll show where. Okay, this is my note, and when I was taking the screenshot, when I was making the same thing, that they have changed it. Okay, the new one. Here, men with brother or multiple first degree, they haven't mentioned anything about the 60 years, right? But in here, today I download this one. So here you can see if diagnosed before 60 years, they have mentioned. Okay. So please follow this one, okay? Because these screening guidelines are always changing. That's what I'm telling to follow the updated one. Okay. Today I downloaded this book again for these classes, and you can find this in the group as well. I have already shared. So you know who are the average, moderate, and high risk patients, not patients, people. Okay, then how we should screen these people. Okay, and you have to know there's a small facts you have to remember here. Okay, GP should not order a prostate specific antigen, the PSA test for men, unless they provide informed consent for the screening. Okay, so please remember first we have to take the consent from the patient. Like we have to explain pros and cons of this PSA screening, then we have to take the permission from the consent from the these people. Okay, then offer men the opportunity to discuss the potential benefits and harms of PSA testing and the screening test for prostate cancer. The same thing we have to explain about benefits and harms. Then for men age for men age 50 to 69 years at average risk, okay? Average risk of prostate cancer who have been informed of the benefits and harms of testing and who decide to undergo the regular testing for prostate cancer offer PSA test every 2 yearly and offer further investigation if total PSA is greater than 3. Okay, so please remember this. Okay, if the patient is average risk, we have to start the screening at age of 50 to 69, but before that we have to take the consent from this patient consent, and we have to perform it every 2 yearly. Okay, then for men, I will explain this PSA test in other criteria, the like this more than 3. I'll explain it. Before that, we will go through the risk wise category. Okay, then for men at moderate risk of prostate cancer due to family history, offer testing every 2 yearly from age 45. So average from 50 to moderate age start from 45 and every 2 yearly. Then for men at high risk of prostate cancer due to family history, offer testing every 2 years from age 40. So you can remember it as high risk from 40, moderate 45, and average as 50. As you have to you have to take the -5 from each category. High risk 40, then yeah, if we going from average we have to -5 by each, so average 50, -5, moderate 45, high from 40. Okay, or you can remember in other side high 40, moderate 45, and average from 50. Okay, so the same thing every 2 yearly PSA testing. Then they have mentioned some more points, and in June they have asked this. Here, for men aged 50 to 69 years with initial total PSA more than 3, we should offer repeat PSA within 1 to 3 months. Okay, PSA we have to repeat within 1 to 3 months. Okay, then for those with initial PSA more than 3 and up to 5.5, it's in the group doctor. Today I have shared this red book, the preventive something, the name, so you can find it out like after the main message. After the main message that I have pinned about the this the time plan, the week plan. After that you can have this one, or someone can like pin this one. Okay, the guideline. Here the next one, You should remember if the PSA more than 3 and up to 5.5, we have to measure free to total PSA percentage. Okay. Please remember more than 3 and up to 5.5, in that case free to total PSA percentage at the same time as repeating the total PSA. Okay. And they have mentioned advise men whose age is more than or equal to 70, who have been informed of the benefits and harms of the testing and who wish to start or continue regular testing, that the harm of PSA testing may be greater than the benefits of testing of men at their age. If the patient need to do this testing, still we can follow after 17, but only if patient won't. Yeah. Then they have mentioned one more thing. PSA testing in men who are likely to live less than 7 years is not recommended. If the patient is having some malignancy, or if living expectancy is like less than 7 years, we should not advise for the PSA. Okay, so remember these things. Then digital rectal examination is not recommended as the routine additional to PSA testing in asymptomatic men interested in undergoing the testing for early diagnosis of prostate cancer. Yeah, that's all for the prostate. And I know you can have some like confusion, because recently they have release some new guideline kind of thing. Okay, RSAGP, some article, not guideline, article. And they are in that article, actually it's the same thing. Okay, same thing they are telling, but they are like more focusing on this PSA testing. And like they shows the most benefits from this PSA testing, and they are highly recommending this PSA testing. If you want, you can go and check that. But it's actually the same thing, doctors. Okay, so that's what I have to tell this, because I know you will have a confusion because of this, right? Okay, so yeah, that's all for prostate. Let's do some questions. Yeah, that's all for prostate. Okay, that's prostate screening. No, you don't have a screening part, right? Let's check. Do we have something? Abnormal prostate on DRE. Total pro. Let's check here. PSA. But they have given in here. I think it could be the. No, right. Give me 1 minute. I had to find out the questions, doctors. Let's go through state. I think they are in here. They have mainly asking about the prostate cancer guideline, right? Okay, let's check one by one. Recommended. Okay. I still couldn't find a question. If you can find something, please send me the link in the chat, the emergency link, then I can go, and I'm just still checking because most of the questions are focusing on the prostate cancer treatment. That's a very high one, right? The prostate cancer treatment. Okay, where is that? No. Okay, I found one. Most of them with the treatment. Okay, we'll do this one question. Otherwise, it will take much more time. Yeah, only one question, doctor. I have went through all the 28 question and I find out only this one. Okay. Okay, here. A fit and well 65-old man attended the GP for the health check. During the interview, he asked if he should have any screening test, such as one for prostate cancer. He does not have any urinary symptoms, but state his father was diagnosed with prostate cancer at age of 70. Which one of the following most appropriate next step? What do you think, doctors? Type your answers in the chat. Easy question. Mm-hmm. Yeah. Here, that patient must provide informed consent to their GP to perform PSA screen. Please remember, okay, we need consent. That the potential benefits and harms of PSA should be discussed when offering screening and recommended for this asymptomatic man age between 50 to 70 is discussion of pros and cons of PSA with his doctor, and patient would still be considered at average risk of prostate cancer despite his father's history of prostate cancer at 70. Those at moderate risk are men whose brother or father were diagnosed with prostate cancer before 60, or multiple first degree relatives diagnosed with prostate cancer. Those who are at higher risk with three affect first degree relative, they are mentioning everything, right? Yeah, they are mentioning about pros and cons. Yeah, the same thing, doctor. So patient is we have to get the consent from our patient. Yeah, that's all for the prostate cancer screening, doctors. Yeah.